Good day to all of the students of Camarines Norte State University. This is your daily news and I am Maria Cristina C. Fontanilla reporting. Natural hazards are naturally occurring phenomena caused either by rapid or slow onset events which can be geophysical, hydrological, climatological, and meteorological. One of the natural hazards is earthquakes. Earthquakes are the weak to violent shaking of the ground produced by pressure or by the sudden movement of rock materials below the Earth's surface. The National Earthquake Information Center now locates about 20,000 earthquakes around the globe each year, or approximately 55 per day, making it the most dangerous hazards among many. To understand how our rescuers and first aiders respond to this type of phenomena, we have our campus rescue team online, Mr. Carlos Garrido. Good morning.
Hello, I'm Giancarlo Garrido, the team leader for this rescue team. As a team leader, I'm responsible for checking the area or surroundings if it is safe for the team to execute the rescue operation. I'm mostly the one making the decisions for the team and keeps in monitor of everyone's work.
As a secretary, I interview the victim if ever he or she is conscious. I ask for the patient's identity and if possible, I communicate to pinpoint any location of pain and sensation. I take note of every injury the patient have and report it to the person in charge.
Hi, my name is Mike Anazet, and as the first aider, it is my job to perform the first aid treatment to the victim, such as bandaging and transferring the victim together with the team.
Hello, I'm Princess Mariam Aziz, the second aider of this response team. As a second aider, I assist the first aider to give aid to someone who is injured and also to lessen the cause of harm happened to the patient.
Hi, I am Mark Lawrence Enrocabo and I am a logistic in our team. The role of the logistic in our team is to give operational support to programs with close adherence to the internal and donor protocols and procedures, and this can include the procurement and supply chain management, responsible for procurement and management for transport, custom, warehousing, field distribution, and commodity tracking management. It also includes the asset and equipment management such as the management and maintenance, financial planning and needs, forecasting, and design and implementation of equipment and management procedures. For instances, without warning, and in a few seconds, everything around you seems to be violently shaking. So, what we're gonna do if this happens?
For the preparation, we need to first prepare all of the necessities needed in a rescue. We need hard hat, task mask, pair of goggles, pair of work gloves, pair of Epsom gloves, pair of knee pads, flashlight, whistle, vest, triage bag, multifunction tool, water pouches, notepad, pencil or pen set, marker, CPR mask, sterile pads, sterile gauze rolls, first aid kit. A first aid kit must contain all of the following. Next is continued daily routine, which is the training about calamities. So for example, these are workshops, seminars, or training related to disaster preparedness. The aim of disaster management training is generally on developing participant technical skills but also on staff and the team management. And lastly, be on duty in case someone calls for a meeting.
These are the things that we must do during an earthquake. We must remember to do the duck, cover, and hold. One of the basic things that we must do during an earthquake is that drop to the ground, take cover by getting under a sturdy table or other piece of furniture, and hold on until the shaking stops. Stay away from glasses, windows, outside doors and walls, and anything that could fall that can usually affect your head. And also, there are things that we must consider during an earthquake. If you are outside, go to an open area where you are away from buildings, trees, and electrical lines. If you are in a car, pull over and stop and set your parking brake. If you are inside, stay and do not run outside and avoid doorways. And lastly, if you are in bed, turn your face down and cover your head and neck with pillows.
Next is the steps for after the disaster. This is the time to execute the procedure in doing the rescue, which are the following. First, the team leader shall check the surroundings to identify hazards and see potential cyclones. Having this kind of information is crucial as it will greatly help the team, especially this can be a matter of between life and death. Second, after checking the surroundings, the team leader will inform the others about it. It is essential for everyone to know the situation in order to have a better decision and understanding on what lies ahead. Third, all members will enter the area to look for survivors or victims. Fourth, if a survivor or victim is found, check whether the survivor or victim is conscious or unconscious. If conscious, you can ask him or her questions about his or her current state, but avoid making the survivor or victim panic, as this will make the situation worse. Fifth, if a debris is obstructing the survivor or victim, slowly remove it without affecting the survivor or victim's current state, in order to transfer him or her to a safe place. 6. Repeat step number 4 and 5 if more survivors or victims are found. 7. After rescuing all survivors or victims that are found, treat them with first aid while interviewing about their personal information and also about the incident. It is important for every member in the rescue team to know about the basics in using first aid. So here are some of the first aid treatment.
First aid for bleeding. So first, cover the wound with gauze or a cloth. Why do we need to put a gauze or a cloth? We need to put a dressing to absorb any leakage from wound and also protects the area until the wound is healed. Next is to apply direct pressure to stop the blood flow. So if there is a severe bleeding in your patient, you must apply firm pressure directly to the bleeding site. The pressure will help to stop the bleeding. And lastly, don't remove the cloth or the gauze. If you remove the cloth too often, it will cause the cloth that is forming to be broken. You must add more layers if needed, because if the blood soaks through the gauze or cloth, you need to apply another layer and more pressure. By doing this, the cloth will help the clots form and it helps to stop the bleeding.
First aid for suspected fracture. 1. Don't try to straighten it. Never attempt to straighten or change the position of a dislocated joint or broken bone because it could make the injury worse. 2. Stabilize the limb using a splint and padding to keep it immobile. Immobilization restricts motion to allow the injured area to heal. It can help reduce pain, swelling, and muscle spasms. 3. Put a cold pack on the injury. Avoid placing ice directly on the skin. Applying ice to the site results in the constriction of blood vessels, reducing circulation and swelling. It may also be effective in reducing pain. It is important to protect the skin from direct contact with a compress and use a cloth barrier. If you apply cold directly to your skin or apply cold therapy for an excessive amount of time, skin sensitivity and or allergy to cold exposure may result to this. 4. Elevate the extremity. Elevating the limb will help to decrease blood flow to the injured area and thereby reducing bleeding and swelling. Make sure the limb is supported and the limb will not slip off the support. Elevating the injured limb and applying manual pressure should be done at the same time when no fracture is involved.
As rescuers, we have to be prepared even before a disaster strikes. We are required to have daily trainings, and it is also our task to gather all the things that we need for a rescue, and we should always be on duty whenever or in case someone calls for help. During an earthquake, it is always advised to do the duck, cover, and hold method. However, if you are outside with nothing that could safely cover you or with nothing that you could safely hold onto, it is always suggested to go to an open area where you are away from buildings, trees, and electrical lines that could possibly fall on top of you. Now, if you are a rescuer, you and your team are required to do some procedures after a disaster strikes, and those were discussed by our team leader, Carlos. And we might all know by now that injuries are inevitable, which is why it is indeed important to know the basics of first aid. First aid for bleeding and suspected fracture are both discussed by Carlos together with our second aider, Marjorie. Today, we have discussed what to do before, during, and after an earthquake, and why those procedures are important in order to be safe. But always remember, those will be nothing if we fail to apply it when the time comes. So always be ready and always be alert. That's all for today. Again, this is Mikey reminding you that by failing to prepare, you are preparing to fail. Thank you.